Hello, my name is Haley Radke. I am getting on to talk about a neurological communication disorder. The case study article I found that describes a neurological communication disorder is called Penetrating Injury to the Brainstem After a Nail Gun Accident, a case study by Botch. This article is about a non fatal penetrating injury to the brainstem that offers a unique opportunity to assess subcortical auditory pathway functions. The case study is of a patient suffering a severe nail gun accident. The patient is a 24-year-old white male evaluated for a follow-up on a accidental nail gun injury to the left cerebellum and brainstem that occurred 32 months prior. The patient fell 3 feet from a ladder while holding um, a pneumatic powered nail gun in his left hand and accidentally discharged a 3.5-inch 10-penny nail into his left subcortical area. So I got kind of an image of where it is at, which is right here. And here is a side of it. The nail penetrated the temporal bone, posterior foci, cerebellum in the pons area. When discovered, he was unconscious and had a pinpoint pupils, and had a Glasgow Coma Scale of 8, indicating a severe brain injury. A CAT scan showed a nail extending through the left temporal bone, the cerebellum near the cerebellopontine angle in the dorsal pons, and producing into the right cerebellum. Throughout this presentation, I'm going to talk about some of the neurological symptoms that arise with his injury. First, let's keep in mind that penetrating injuries into the brainstem are very rare. When looking at our patient's neurological symptoms, it included gait ataxia and a tendency to fall frequently. Gait ataxia is a person's walking ability and characteristics. Coordination of upper limbs was difficult. Handwriting was slow and difficult. He was left-handed, but right-handed was more awkward. For speech, it was characterized as dysarthric, meaning speech is slurred and uncoordinated due to the central nervous system and the peripheral nervous system. Problems that affect one of the more following, such as respiration, phonation, resonance, and articulation. He described some difficulty with swallowing, like especially with liquids, and sometimes he had nasal issues. The patient was unaware of reduced hearing in the right ear and a continuing repetitive clicking sound in the right ear, so possibly tinnitus. Occasionally, he noted brief vertigo with quick head movements. He was aware of reduced sensation over the entire right side of his body. Several times each day, he had involuntary twitching and jerking movements in the right abdominal wall, which sometimes involved the right side of the body and the right shoulder. All of his neurological symptoms has been present since his injury. So all of these occurred since his injury. Just to go into more of the speech and language concerns, it was indicated that the patient had mixed ataxic hyperkinetic dysarthria with the hyperkinetic component reflected in a palatal-pharyngeal malacosis. When looking at dysarthria, some things that we should consider is etiology, lesion site, motor signs, and speech symptoms. Ataxic hyperkinetic dysarthria affects the cerebellum, which is like motor control, neuromuscular symptoms, which is like movement and slowness of movement, perceptual characteristics such as imprecise consonants, irregular articulatory breakdowns, prolonged phonemes, prolonged intervals, and a slow rate of speech. For the audiologic portion, of the case study, it was noted that imbalance and unsteadiness of hearing loss was noted, and the test was determined. An audiology test was to determine hearing loss. The results revealed normal hearing sensitivity for the left ear from 250 to 8,000 hertz. However, it was slightly poor, but normal hearing sensitivity for the right ear, with exception of a 1,500 hertz. When also looking in this area, when looking at word recognition scores, it ranged between 80 to 90% in the left ear, and it was lower in the right ear, ranging from 55 to 60% with a 25 decibel in a sensation level. But overall, like in summary, getting to look at penetrating brain injuries, understanding how rare they are, it is a great opportunity to be able to examine. It was a great opportunity to examine of a subcortical auditory pathway when looking at speech and language evaluations, audiology tests, acoustic reflections, and a vestibular assessment. I really enjoyed getting to do this assignment and getting to do this presentation. So I hope that you enjoy my video. Thank you.